Okay, so we'll get started. So my name's Eric and I'm with Volunteer Canada. Welcome to the Volunteering 101 for prospective health sector volunteers. This session is planned for a maximum of an hour, but it may end a little bit earlier. So we've actually shared this session across the country. So as Kate did in the comments, please let me know where you're listening to the session from. We've got a couple housekeeping notes before we delve into it. This session will be recorded for all those that have signed up to listen to the session, whether or not they've been able to make it for right now. And following the presentations, our presenters will be taking a Q&A. So if you see beside the chat, the Q&A button, just post your questions in there. We'll be trying to get to as many as we can during the session. Next slide, please. So a quick note about my organization, Volunteer Canada. Volunteer Canada provides national leadership and expertise on volunteerism. Since 1977, we've been working closely with volunteer centers, nonprofit and charitable organizations, businesses, governments, and educational institutions in order to achieve our mission to provide leadership in strengthening citizen engagement and to serve as a catalyst for voluntary action. During the pandemic, we've been producing and collating a number of resources centering on topics such as volunteer management, public health, sector advocacy, and corporate community engagement. And all those can be viewed on our resource page of our website. Volunteer Canada is hosting this session to encourage volunteerism towards prospective volunteers, and more specifically, volunteerism in the health sector. One of the most common reasons that people give when they're asked why they haven't volunteered is that they didn't know that there was a need. According to our Ipsos-run survey, The Volunteering Lens of COVID-19, 13% of respondent organizations have actually increased their need for volunteers during this time, be it in person or virtual. Next slide, please. I'd like to acknowledge our funder for the Health Sector Spotlight Series. It's been made possible from Points of Light and a COVID-19 response fund grant from the Center for Disaster Philanthropy to support long-term recovery efforts of volunteerism in the health sector. Next slide. So I'd like to introduce our presenters for today's session. We've got Deirdre Millen from Volunteer Toronto, who's the training specialist. Betty Ng, Human Resource and Volunteer Services Specialist from Sprint Senior Care. And Eileen McGeehan, Supervisor from Meals on Wheels. Deirdre, over to you.
Okay, great. Thank you, Eric. And thank you to Volunteer Canada for this Health Expo and inviting Volunteer Toronto to be a part of it. As Eric said, my name is Deirdre Millen and I'm the training specialist here at Volunteer Toronto. And before we get too underway, I'd like the next slide so we can talk about what we're going to be talking about today. So I've got about a half hour with you, and our goal is that you, by the end of our half hour, you know how to volunteer safely, that you know how and where to apply for a volunteering role, and then finally that you know a little bit more about virtual volunteering. We're seeing a number of organizations across the country rise to the challenge of the pandemic, and they are creating virtual roles that volunteers can access in order to support their communities. I'm going to be showing you where and how to find those and what they look like. So let's get going, and let's talk a little bit, though, before we get into that, let's talk a little bit about Volunteer Toronto, which is our next slide, please. Okay, so what do? Well, Volunteer Toronto, we connect volunteers to information about volunteering, and we do it through our website. And what we do is we showcase all the available opportunities at the nonprofits across the city that are available for people to volunteer at. So most people know us through our website, and that's the service that we offer to volunteer candidates like yourselves. But we also support, behind the scenes a little bit, we also support volunteer managers. And volunteer managers would be the team lead or the volunteer coordinator who's managing a team of volunteers. And we provide them with resources around best practices. If there's anybody who's on the call who's leading volunteers, highly recommend that you go to our website, which is volunteertoronto.ca. Check out our resources page, and under COVID, COVID-19, you'll see we have a whole learning library, which is full of free resources that you can access in order to help support you in your efforts during the pandemic. Okay, let's move on to our next slide, please, and let's talk a little bit about safety. It's really important that you think about the safety piece before you go out into the field and start volunteering. When you know the important safety considerations and precautions, it's going to help you determine what type of volunteer role you should pursue, and it's going to help you protect yourself during the pandemic. So let's take a look at our first slide, our next slide under safety. The number one question we get is it safe to volunteer? The short answer is yes, but only if you take precautions. So I'm going to be outlining some of those precautions to you over the next couple of slides. The recommendation from Public Health and from Volunteer Toronto is that you do not volunteer out in the community if you or someone you are living with is over the age of 65, has a compromised immune system, or has any underlying medical condition. And if that's the case for you, then what we suggest is that you consider volunteering remotely, which is what I'm going to show you a little bit later on in the presentation. So as we're moving through this content, some of you might think, oh, I need to know all this. I want to write this all down. Other people are more comfortable with it and might not, it might not resonate as much for you. Everybody has to find their own personal comfort level with this. And to me, it sort of depends on how old you are and where you are in life. I have a young daughter who's in her 20s. She's a little bit more casual about some of the protocols. But for those of us who are older, you might want to follow them more strictly. So just, think about that as we're moving through the content. Okay, next slide, please. Of course, if you have any COVID-19 symptoms, you have to self-isolate and call a healthcare professional or the public health authority. Those are the guidelines that are being set all across the country. Next slide. Again, and these all came out in March, but now that we're in second wave, they're just as applicable as they were back then. So if you've recently returned from Canada, you've been in another country, or you've been in close contact with someone who's recently returned to Canada, or if you have been in contact with someone who is or is suspected to have had COVID-19, you have to self-isolate for 14 days. But there are also some things that you need to think about. I'm going to show you in our next slide, please. These are the questions that we want you to ask any organization before you commit to a volunteering role. So the organization has a responsibility to keep their volunteers safe, and most of the organizations are going, in my opinion, above and beyond to meet that need. But you also have a responsibility to yourself to make sure that whoever you volunteer for can answer these 4 questions. So if they don't tell you, you should ask, what safety measures do you have in place to protect volunteers? How will I receive the training for this role? So organizations now are embracing platforms like the one we're on right now, Zoom. They are also doing trainings through Skype, even the telephone. I've seen some of the organizations doing their trainings through phones. So you should know, what kind of training am I going to receive and how am I going to get it? Some organizations are even providing in-person training, but at a physical distance. So just find out what their thinking is before you commit. If I have any questions or concerns, who will be my direct supervisor? Who can I reach out to and talk to if I see something in the field that's making me a little bit uncomfortable safety-wise? Who do I turn to? And then, of course, because we can't all be available 24/7, who is that person's backup? So who do I reach out to if my supervisor is not available? So those are questions you want to make sure that you're posing to an organization before you onboard with them, if they don't answer that right up front for you already. And then if you're particularly interested in healthcare roles, which of course is why we're here talking today, you might also want to just be aware that the safety protocols around COVID-19 change frequently. So you might want to consider asking before you start any of your shifts, are there any new safety healthcare updates that I should be aware of? because the landscape is definitely changing on an almost weekly basis. I know I attend the City of Toronto puts on a webinar every 2 weeks, and they're always like, okay, this is what we're learning this week. So make sure you check in. I think the other thing that's important to remember here is that because we're all trying to respond to the pandemic as quickly as we can, sometimes things get missed. So even though your volunteer manager might have every intention of sharing with you an update, that doesn't necessarily mean it's going to happen. So part of the onus, again, falls to you to make sure that you're asking for those kinds of pieces. Okay. And then, of course, once you're out there, you want to practice proper hygiene. So here are just some tips, things you can do to keep yourself a little bit extra safer while you're out there. Well, you can certainly begin by bringing your own food and drink to the shift. That means that everything that you eat and you imbibe is kind of something that you prepared and is contained within your world. We recommend that if it's possible to avoid using public washrooms. Of course, like all the health professionals are telling us, you've got to wash your hands often with soap and water for at least 20 seconds, especially after using the washroom or before touching food. And I'm sure some of you have probably heard of this trick where you sing happy birthday to yourself in order to make sure that you do the full 20 seconds while you're doing the hand washing. Another thing that you can do, and I know many people are doing this, is just bring a small bottle of alcohol-based hand sanitizer with you wherever you go. And this is what you can use instead of soap and water if that's not available. I know I keep a little one in my purse, and I'm sure most women are doing that as well. Or, you know, it just makes sense. Even my husband, who doesn't like carrying things, is carrying a little thing of hand sanitizer with him wherever he goes. Okay, and then the next slide, please. Yes, thank you, coughing and sneezing. So again, because of the pandemic, we're not sneezing into our hands, right? We're sneezing into our elbow. And in fact, earlier in the call when we were getting ready, one of the people who was getting ready with us, she sneezed, and I noticed she did it in her elbow. And I was like, yay, someone who's well trained on how to do their sneezing. It's supposed to be in here. And she's alone in her home. So she's got herself trained really well. So and then of course you can also use a tissue or a Kleenex, right? But you're not using your hand. If you're using a tissue, you want to make sure that you're disposing that tissue as soon as possible, preferably in a lined waste paper basket, and then you're washing your hands. The other thing that you're meant to do, and this one I find particularly challenging, is you're supposed to avoid touching your eyes, your nose, or your mouth with unwashed hands. And this can be, you know, when you're out and about and you're kind of doing your thing, you're not thinking about, you know, rubbing your eye because you feel a little itchy. So one of the suggestions that I have, it's something that one of my friends who's a senior citizen does, what she has is she has these goggles that she wears when she goes out, and that just stops her from touching her own eyes when she's out in the world. So that's something that you might want to consider for yourself as well. Okay, thank you. So of course, you still want to practice this physical distancing piece. There's, again, recommendations around this. So if possible, you want to avoid public transit and instead consider walking or driving to your volunteer shift. The recommendation is that you not ride in a car with more than one other person. Of course, we're meant to avoid crowded places, any non-essential gatherings. We're avoiding that very common greeting, the handshake. So instead, you're just nodding and smiling at people. We're also trying to limit our contact with people who are at higher risk, like older adults and those who are in poor health. And of course, we want to keep that physical distance of at least 2 arms length from one another. Okay. Now, this is a question that we often get is regarding PPE. And for those of you who don't know, PPE stands for personal protective equipment. It refers to the gloves and the masks that you see a lot of healthcare professionals wearing. So the question is, do organizations provide me with PPE? Will an organization provide me with PPE? And the answer is sometimes. It really depends on the organization and who they serve, how much they have in the way of resources, and the kind of role that you'll be fulfilling. If you're doing a virtual role, obviously you don't need PPE. The other thing to be aware of, and I'm sure many of you know this, that wearing a cloth mask, the ones that we're asked to wear when we go outside, that doesn't protect you, the wearer of the mask. What it does is it protects the people around you. And it is not a substitute for physical distancing or hand washing. What it does is it protects the other people around you from getting COVID in case you're a carrier and you aren't aware of it. Here in Toronto, public health is asking that medical masks and gloves be kept for healthcare workers. And in fact, using masks can actually be a bit of a detriment sometimes because you're touching your face with unwashed hands. So just something to be aware of. Okay, so now that we've covered off the safety piece, let's move into the next section where we are going to start talking about how you find a volunteer role and what you need to do in order to prepare for that transition. So we're going to now look at the 3 R's of securing a volunteer opportunity. Next slide, please. Here they are. Here are the 3 R's. You're going to reflect, you're going to do research, and then you're going to reach out. So reflection is just you asking yourself questions. You know, in fact, just now in the safety portion, you're probably already thinking, okay, well, I'd be comfortable doing this, but I'm not so sure I'd be comfortable doing that. You're already beginning that reflection process. You're going to ask yourself a series of questions to kind of narrow in on the kind of role that feels appropriate for you and your comfort level. Then you're going to do some research, and I'm going to show you specifically where you can go to find opportunities that are local to where you are, because I know we've got people from all the way from Vancouver on the call right now. So we want to make sure that we find websites that are pertinent to wherever you happen to be, and I'm going to show you how to find those in a minute. Then once you've narrowed down to maybe 5, 6 organizations, you're going to reach out and you're going to apply. And what you're going to see is that applying for a volunteer role is a lot like applying for a paid job. Organizations will ask you to complete an application form. Organizations may ask you for a resume. They may ask you for a cover letter. They might even ask you for references. So these are all things that you should be aware of as you go through this process. And it's also a process that takes some time. Okay, next slide, please. All right, so these are the questions that we recommend you ask yourself as you start to think about where you want to volunteer. So first off the bat, what do you want to gain from volunteering? Of course, volunteering is you freely giving your time to an organization, but when you give your time, you're also going to be getting something back in return. You're going to feel like you're making a difference in your community. You know, you're going to feel like you're having an impact on the world around you. That's getting something back. You might be volunteering because you want to meet more people. You want to get out into the community and just meet others. You might be volunteering because you want to build a skill set that is going to help improve and build your resume. So you might be motivated by job seeking needs. So it's perfectly fine to have motivation to volunteering, and just be clear with yourself on what it is and why you want it. Then you're going to want to ask yourself, what skills do I have? What type of volunteering roles might require these skills? So for instance, are you good with people or are you good with numbers, right? If you're good with numbers, that suggests a different kind of role than if you're good with people. If you're good with both, then maybe you join a virtual tax clinic or something like that, right? So think about what kind of skills you have and the skills that you want to use in a volunteer role. And then, of course, what issues are you most passionate about? I think the latest stats are something like 60% of all volunteers because they care about the cause that an organization might serve. So perhaps you really want to volunteer in the field of Alzheimer's because your grandmother passed away because of Alzheimer's. That's you reaching into yourself and saying, okay, this is something that I care about and I want to see if I can move the needle and make a difference on. Ask yourself, will this role help me meet new people? I put that one in there because I often find that people have heard it's a good idea to volunteer while they're job searching, but then they end up volunteering doing something where they're not meeting people, which kind of goes against the whole purpose of volunteering for job search purposes. Make sure that if you're doing it for that reason, that you're in a role where you're getting out there and you're meeting people. And then finally, think about how much time you can commit. Can you do 1 day a week, a half day a week, 1 day a month, evenings, mornings, weekends? Where is your comfort level and what can you commit to? And I'd like to also add that during the pandemic, it's kind of twice as challenging to volunteer as it was before the pandemic. So whatever you think you can do, you might want to pull back a little bit on, because I think we all have to have greater levels of self-care as we move through these spaces. So make sure that when you say you can commit a half day, you've got some white space around that as well. You've got time to take care of yourself. Okay, let's move on to our next slide. And now we're going to talk about the research portion. So the beauty of the internet is it's quite easy to find things now, which is great. But of course, there's so much out there, you have to kind of figure out, well, where do I look first? So one of the things I'm going to suggest is that you visit Volunteer Canada's website, which is volunteer.ca, and you'll see up at the top, I'm going to show you how to navigate through this in a moment, but up at the top, they've got a drop down that says I want to volunteer, and then you just click on choose COVID-19 volunteering opportunities, and it takes you to a page that'll list all the organizations across the country. So next slide, please, so we can just see how that unfolds. So here we are. This is what it looks like when you arrive at the Volunteer Canada site. You click on the orange arrow is pointing to I want to volunteer. Next slide, please. There you go, COVID-19 opportunities. Next slide. There we go. So you can see Volunteer Canada has broken it down by province, and you can see there is, what have we got here? Volunteer Lethbridge, Volunteer BC, Volunteer Burnaby. So you find the region that's close to you and you click on that, and then you'll be taken to a website where they will have opportunities for volunteering. So one of the questions I often get, especially now that we're looking at a lot of virtual volunteering, is do I have to, if I live in Vancouver, can I still volunteer virtually in Toronto? And we are starting to see people who are doing that. And so the short answer is yes, that can happen. But just be aware that there are still local elements that you kind of need to know when you're volunteering, even in a virtual space a little bit. So there's definitely still a bit of a preference towards local volunteers, which is why I'm steering you to this page, because I think it'll take you to where you need to be. So once you're on the site of your local volunteer organization, you will find postings that look an awful lot like a job board. If you've looked at Workopolis or Indeed, you're going to see something very similar on the volunteer center that's local to you. And so I'm going to share with you a couple of opportunities that are from the Volunteer Toronto website that I just wanted to share with you and give you an idea of what kind of opportunities are out there right now and the organizations that are looking to fill roles. So if we could just show you the next slide, please. Yeah. So this is an organization here in Toronto called Reconnect Community Health Services. This organization, like many, many organizations across the country, are looking for drivers. Almost all the Meals on Wheels programming organizations have seen a real spike in service demand. A lot of people need more Meals on Wheels are needed than ever before because of the pandemic, and as a result, more drivers are needed. This organization is looking for drivers to help deliver hot meals to seniors and adults with disabilities. As you can see, usually in the posting, they'll list things like, here's the time frame, like they want somebody from 10:30 to 12:30, Monday to Friday, and they even list the routes that they're looking to fill. So if you want to get started right away and you have access to a car, you will most likely find something fairly quickly because this is definitely one of the most in-demand roles. But I wanted to show you another healthcare-oriented one. Thank you. And this is an organization called Birthmark. They're an organization of doulas that provide support both, I don't want to use the term medical. That's a little bit too strong for a doula. A doula provides some kinds of medical supports, but also emotional support to mothers that are expecting children. So this organization is looking for someone to be an in-kind donation support person. They would work underneath the donations coordinator. And basically, you're just folding and sorting some of the donated items that are coming in. You would probably also be sterilizing them, probably restocking the giving wall that they have, and processing all new donations that are coming in. And this position helps Birthmark present their resources and augment their resources to better assist and direct the needs of their clients. Okay. So now that we have a rough idea of what we're aiming for, let's talk a little bit about the reaching out process. So as I mentioned before, most organizations have some kind of application form that they will want you to fill out. And it really depends on the length of the commitment that you're looking to fill. So when an organization is looking to fill a role that lasts 6 months, a year, even really anything longer than 3 months, you can expect them to ask for a resume. That's pretty common. And or a cover letter. But definitely some kind of application form is usually the norm. And once they've received your application, they have a chance to look it over, then they're going to call you in for some kind of interview. And this can be as informal as a quick phone call to something much more formal where you're attending a live Zoom call where maybe 4 people are interviewing you in a panel situation. Or even, you could even be one of like 20 people. Sometimes they're doing big group ones as well. So, you know, just expect that that might be part of the process for you, that there will be some kind of interview. And then don't be surprised, and because quite often people are, don't be surprised if you're asked for references. And this is often a concern for people because they may not have any recent job experience. They may not have any recent Canadian experience if you're a newcomer, or if you're a youth or you're still in high school, you might not have any real work experience at all. So don't forget that references don't have to be former employers. They can also be things like a religious leader, social worker, settlement worker. If you play sports, a coach can be a reference. So those are other options for you as well. And don't be surprised if you're asked for a reference, especially if the role that you're looking to fill is one that requires what we call a high level of trust. So if you're working directly with seniors or other vulnerable people in the community, a reference is really the norm. Okay, so, and if you want supports on applications and interviews and all that kind of stuff, lots of good stuff to be found on, used to be called lynda.com, now called LinkedIn Learning. But there's all kinds of tutorials on how to do good interviews. There's good books. I love the library. Go to the library, get some books on how to do interviews. There's all kinds of, and YouTube's got tons of videos and stuff out there to support you on that if you feel like you need any more anything to kind of bolster your nerve, because I know interviews aren't for everybody. Okay, let's talk a little bit about volunteering from home, which is our next slide. Thank you. So we mentioned this before, but one type of formal volunteering role is volunteering from home. And more of these positions are popping up on our site as organizations adjust to this new reality of working with volunteers online. So these roles can take many shapes. You can be, so in the past, we've had friendly visitors to remote seniors. that used to happen in person, now we're seeing it happen in virtual spaces where you can make a phone call to a senior who needs a little isolation support, or you can do a Zoom call, or you can do a Skype. IT support is something that can be done virtually. Grant writing, fundraising, graphic design, website design, all these things are being asked for and sought out in virtual spaces. So let me give you an example of that. In our next slide, I'm going to show you. We have a posting on our website for an organization called Let's Stop AIDS, which is a youth HIV charity that focuses on HIV prevention and knowledge exchange. And they do this by engaging young people and fostering leadership. They're looking for a marketing specialist. So this would be somebody who would be helping them with their Facebook and their Twitter and maybe YouTube videos and that kind of thing, and creating a campaign to build awareness for this organization. And in the posting, there's even more details. They're looking, they specify, they want 8 to 12 hours a week. They will give preference to somebody who has lived life experience in the HIV world. And even though this is a virtual role, in the future, when they're on the other side of the pandemic, they're hoping that this person would be able to come into the office on a bi-weekly basis. So these are the kinds of details that you can get when you're looking at the postings and trying to figure out if this is a good fit for you. I want to share one more with you. Thank you. Yes, this is from the Textile Museum. Great little organization here in Toronto, and they are looking for volunteers to sew masks at home. They will provide you with the fabrics to do it. They'll also give you a pattern to work from. Unfortunately, they're not able to provide lessons on how to sew. So you have to know how to sew, and you have to have access to a sewing machine. But with this particular organization, you can go down, pick up the materials, go home, create the masks, and then drop them off at the museum when you're finished. And there's a link there on the slide. If you go to their website, which is textilemuseum.ca, and then go into their About section, under Get Involved, you'll find out the details on how to be part of that, if that's something that is of interest to you. And I wanted to share this with you because this is kind of a new thing that's happening in the volunteering space, something called micro-volunteering. So what we traditionally think of as volunteering is an ongoing commitment, once a week, once a month, right? Something, or maybe even a special event. But what we're seeing organizations do, like F-Cancer, is they're providing opportunities for you to be a micro-volunteer. So micro-volunteering are usually short-term, one-off tasks that can help an organization move towards its goal. So examples might be translating one letter into French, writing a thank you letter to a donor, designing a logo, or creating a short animation, which is what we're seeing here with this slide. In this slide, I wanted to show this to you because Chris, who's an animator, donated 10 hours of his time in order to provide an animation for the Leukemia and Lymphoma Society. And F-Cancer, even though they're based in the UK, they help cancer organizations all across the globe. So every once in a while, you'll even see a couple of Canadian organizations in their lineup. So these are obviously quite skilled, like highly skilled tasks that are being assigned. But sometimes there's something as simple as, sew a toy or make a homemade toy for one of our clients. So something that you might want to look into if you're interested in providing just a short burst of time. Because what's happening is organizations are noticing that people are very hard pressed to make that long-term commitment. So they're coming up with these smaller tasks that you can come in, swoop in, do 10 hours, you're done, and then you go on. And if you want, it can become probably become an ongoing relationship, but it's a way for you to volunteer, short and sweet. Okay, and then our next slide is our, don't get discouraged slide. So we put this out here because we don't want you to be discouraged if you don't hear back from an organization immediately. although there's great need out there, everybody recognizes that there's definitely great need. It takes a lot of skill and time to coordinate volunteers and to respond to applications. And many of the organizations that you may be applying to may not have the capacity to screen volunteers within a few short days. So even volunteer managers at really well-established nonprofits are still adapting to screening volunteers remotely. We're still trying to get a handle on it. So we recommend that you apply to 5 to 6 different roles at the same time and keep checking in on a weekly basis. And in the meantime, while you're waiting for that dream volunteer role, consider volunteering what we call informally by doing something like calling an isolated senior in your family who could maybe use a call, or helping a neighbor down the street get their groceries. You know, these kinds of informal volunteering opportunities can help you get out there right away if you really want to act on things now. And I think that's everything for me until we get to the questions portion, which I think is going to be happening after we talk to Betty and company. Yes?
Yes, exactly. Thanks
okay,
so much,
great.
Deirdre.
Thank you.
And as Deirdre alluded to, there's a great need for Meals on Wheels activities right now. So I'd like to introduce Betty and Eileen with Sprint to talk about some of their ongoing activities. Betty, over to you. You're still muted.
Thank you, Eric. Okay, my name is Betty. I'm from the Sprint Senior Care. I'm here with my colleague Eileen. We're going to present our experience with engaging volunteers during COVID time. So I will start. Can we go to the next slide? I just want to tell you a little bit more about our organization. So we are Sprint Senior Care. We are a nonprofit community support services. We have around 275 staff members, and on average, we have around more than 300 volunteers every year. What we do is we provide a basket of practical, low-cost programs and services to help seniors stay safe, connected, and live as independently as possible. Who we serve? So can we go to the next slide? Thank you. We serve over 4,000 clients every year. So our average client is low-income woman who is over 80 years old, who live alone, has a number of chronic health conditions, and they usually have very few social support. Next slide. Thank you. So this is our service area. We're mostly Midtown Toronto. So you can see from the map, it's Bloor to 401 and Bathurst to Bayview. So where the red star is our head office located. Okay, next slide. So this is overview of our volunteer services before COVID. So as I mentioned that we have over 300 volunteers and they served in different programs. We have volunteer helping in community wellness team with the dining program, with exercise programs and social programs. And we also have volunteer help as a dementia care volunteer. They're doing on-site friendly visiting to our dementia care residents. And we also have lots of volunteer helping in Meals on Wheels program, where they can be a driver or a kitchen assistant. We also have volunteer helping in transportation as well as office support. Okay, next slide. So since COVID started in March, we have to stop those on-site volunteer on-site volunteer positions. The only one that is kept going is Meals on Wheels drivers. We can't stop the food program because the senior clients are depending on this program to get hot meal and cold meals. Okay. At the same time, we also launched this COVID-19 community response team project to address the more like food security needs in the community. So the programs including food and essential items delivery, like free meals program, grocery delivery, food bank, and as well as mobile farmers markets. And we also have some virtual programs launching with this project. We have wellness chat program as well as virtual social and recreational programs. Can we turn to the next slide? Thank you. So this is some photos I want to share with you. So the first photo is actually from the, it's the grocery program where the volunteer help us to pick up the grocery from the Sobeys, from the store, and to bring back to the office for quality tracking and before they deliver out to the clients. And the second photo is about us when volunteer come into our program site to pick up the free meals. They get a huge bag of meals and they go into the community to deliver to the seniors. The third picture is our food preparing area. As you can see from the picture that we lay out the tables at least to ensure that all the volunteers and workstations are at least 2 meters apart. The last photo is just volunteer couples that they came in to pick up the meals and to help with delivery. Okay, next slide. And this is this my own experience on the volunteer engagement during COVID time. So after COVID shut down the city, we were losing many volunteers in different programs as well as in Meals on Wheels. And in addition to Meals on Wheels program, many new projects, as I mentioned, were popping up to assist the community. Even with the shutdown, our programs were still running as we had implemented the new safety procedures. So this caught the eye of Toronto Star and our local city councillor, in which they commended our hard work. Shortly after the article was published on Toronto Star, we received an influx of volunteers. So we were able to receive over 300 volunteer applications during that time. So these new volunteers were critical to our new community projects and the Meals on Wheels programs. And the second wave was in June. As individuals start returning to work, the level of volunteer reduced, and we began to see more post-secondary students and the volunteer applicants. They wanted to volunteer as family. So this applications dropped even further in late August as family were debating whether or not they should send their kids back to school, and the post-secondary students had to reduce their hours or they couldn't volunteer anymore as they were going back to school. So so the things kept changing. Sorry, I'm not done yet. Can we go back to the last slide? So things kept on changing during COVID, that we never know what is coming, like I said, tomorrow or next month. So we're just hoping that we are having enough volunteer to sustain our programs to support the seniors who has need in the community. Okay, next slide. Yep. So I know the Volunteer Toronto expand a lot of safety measures, and this is what we have in place. So hand hygiene, we asked house screener questions every time when volunteer, prior to the volunteer shift day. We strictly we have very strict physical distancing. We ask volunteer when they work on site or even when they go out for delivery. All the delivery programs are contactless, and we most recently adopt this mandatory mask use requirements, and we always cleaning and disinfecting the workstation before and after use. Okay, next slide. Okay, I'm going to pass this on to Eileen.
Hi, everybody, and welcome. I'm the supervisor of the Meals on Wheels program, and we serve the catchment that was previously noted out of Sunnybrook Hospital. And luckily, our hospital food supplier did not shut down during COVID like they did way back in SARS. So we weren't left scrambling for a food supplier. So we were able to continue to operate 7 days a week and right through the pandemic, since we didn't adjust our services at all since it started. Our program offers hot meals, frozen meals, wellness boxes, which are boxes of fruits and vegetables, especially geared to seniors, milk, and sandwiches. Next slide. During COVID-19, we lost about a third of our volunteers, and we're a program that prides ourselves on our volunteer force, and a lot of our volunteers have been with us for a long time, like 3 or 4 years, even more. So we did lose a lot of people, and the major reasons were that they were over 70. They themselves had compromised immune systems, or very commonly they were caregivers for frail elderly or ill family members. Some reported that they did not want to work in the community at all until there was a vaccine. So what we're doing in our daily activities now is making sure and reassuring our clients that we will never send a sick person out. And we send an email to all the volunteers who are coming in the next day and ask them to answer a series of questions, which they call in and they say, all my answers are no, then they can come in for their volunteer shift. Our logistics changed a bit with our entry and volunteer parking. It changed dramatically overnight. So we had to adjust procedures for that. And the delivery procedures were changed to a contactless delivery, and we did enlist the client engagement with this. We asked them to put out a table or a chair. So basically, a volunteer would take the meal up in a plastic bag, knock on the door, hang it on the doorknob or a chair or a table, and step back 6 feet. So they do get to greet their client and have a little conversation, because there is a social component to Meals on Wheels, and then they step back. Okay, next slide. Thank you.
Thank you, Eileen. So here I actually bring into our current volunteer opportunities. The first one is with the Meals on Wheels team, Eileen just mentioned. So for this program, the volunteer will be helping delivering meals in Midtown Toronto. And the volunteer hour is usually weekday mornings, 10:30 to 12:30. And we're looking for a commitment once a week for at least 2 months. The second opportunity is mobile farmers market. We're going to relaunch this program in early November, and we definitely need volunteer support in packaging and delivering freshly produced. For this role, the volunteer schedule will be every other Thursday and start at 10 a.m. It will take about 3 to 4 hours to complete packaging and delivery. But if the volunteer chooses to do one thing, it will be roughly 2 hours. Okay, next slide. So during this time, Spring had interviewed some volunteers who support us during COVID. We have posted all these videos and on our Facebook and YouTube channel. So we don't have much time to share this to all of you, but the link will be shared after the webinar. Okay, next slide. So this is all about our presentation. Thank you so much. And if you're interested in volunteer with us, you can definitely go to our website, www.sprintseniorcare.org, or you can send an email to volunteer@sprintseniorcare.org directly. Thank you.
Perfect. Could we go to the next slide, please? All right, so this is the opportunity for individuals on the session to ask questions of our presenters. Deirdre, I wanted to start with you and ask about asking for a reference from volunteering. How do they go about doing that?
So I'm so glad you asked this, Eric, because we get asked this quite a bit. Many times people are volunteering because they want a reference, because they're looking for somebody to say something nice about them so that it would be easier for them to get a job. So some organizations are very upfront about how long you have to volunteer with them before before they'll entertain the idea of a reference. So when you're doing that initial interview, you can let them know. You can say, you know, one of the things I'm interested in when I volunteer here is if you feel it's appropriate getting a reference. I don't know how long you'd want me to volunteer here for in order to be, you know, in order to be considered for a reference, but just so you know, that's something I'm interested in. So let them know before you even start that that's something that you're looking for. And then they'll say, oh, well, we don't do that unless you're here 3 months or whatever. And then, of course, you have to actually do a good job, right? So even though they said they would give you a reference in 3 months, you have to make sure that you're actually delivering on it, right? You're showing up on time. You're letting the person know if you have to call in sick, you know, in advance. You're doing a good job while you're there. You're being courteous to clients and customers and friendly and all those kinds of good things. So, because sometimes people say, well, they said they'd give it to me and then they didn't. And then part of me always kind of wonders, well, maybe you didn't do something the way you should have. So it's not just a promise. It's also, you have to actually, like, you know, do a good job, be worthy of it. The other thing I suggest is that when you ask for a reference, ask for a LinkedIn reference, because then it lives on your LinkedIn profile and anybody can see it. So, and I even suggest to people that they write the reference for the person giving the reference, email it to the person and go, here's what I was thinking in the way of a reference. Then they can edit it and post it on your behalf through LinkedIn, and there it sits forever, and then you never have to bug them again for a reference.
Perfect. So. Thanks for those tips. Betty,
yes.
Could you let the audience know what screening practices have been like for your group during COVID times?
Right. So as Deirdre mentioned about the screening process, we do ask volunteer applicants to fill out the application form with your contact information, your availability, your interest, where you want to volunteer, what you want to volunteer for, as well as your reference contacts. So you will be asked to provide the reference contact. So that's the first part. After we receive the volunteer application, we will contact volunteer to schedule a phone interview, a short phone interview. We used to ask volunteer to come in for in-person. However, we can't do that anymore since COVID. So everything become turned online. We communicate through phone or through email. And after phone interview, if we think you are a good fit for the role, we will ask the volunteer candidate to fill out a backtrack consent form, because senior care is vulnerable sectors. We do need a non-criminal check. And if the volunteer candidate is applying for driver's role, we also ask them to provide the driver's license number for us to conduct to process the driver's abstract, which is 3-year driving history. Okay.
Perfect. Thanks for laying out the volunteer application process.
Right. I saw there is a question about who pays for the backtrack. So we will pay for everything for volunteer candidates. Yeah, it's our, I believe different organizations ask volunteer to a different way.
Yep.
Some organizations will ask volunteer to do, to get the police check from police service. But what we do is we ask, we have a like authorized partner. We can process everything in-house.
Perfect, thanks. Deirdre, a question for you on for any of the newcomers that might be on the call today. Kind of a three-parter, if you will. Do you need a work permit to volunteer? How do you provide or get references if you don't know anyone in Canada? And if you don't have any work experience in Canada, does that affect a volunteer position?
Okay, so the first answer is, do you need a work permit? No, you don't need a work permit. So that's the good news. The good news is you don't need a work permit. References, I know that can be tricky, especially if your references don't speak English, right? Maybe from your home country, there's that language gap, if you will, between your past life and your current life. So you can, so again, a settlement worker, so most newcomers have a settlement worker, a religious leader, a family friend, or even your landlord can be a reference for a volunteer role. And the last question was?
With regards to work experience.
Work experience. So no, you don't have to have work experience, Canadian work experience, in order to get a volunteer role. In fact, if you don't have any Canadian work experience and you go out and you do volunteering, it can be helpful because for a future job search, that's helpful because then an employer can see that you know Canadian culture well enough that you can function in a volunteer environment. So there's all these what we call soft skills that come when you volunteer, because you have to show up on time, right? You have to write a professional email to the organization. You have to pass the police check. There's all these things that come with it that look good on you to a future employer. So you don't have to have Canadian experience. If anything, it's going to give you that Canadian experience that's going to help you down the road in your job search.
Perfect, thank you. Betty, I did see that there was one question with regards to a driving record abstract.
Okay, I can answer that question. So what we do is we process this through Service Ontario. On the website, there you can apply for uncertified 3-year driving history, and that's how we process the driver history check.
Perfect.
Yeah.
Well, thank you both for answering those questions. Could we go to the next slide, please? All right, so I've laid out the contact information for the individuals on the call today. Please take a note or take a photo of it. We will be sharing the recording of this session as well as the slides post-event, as well as any of the resources that the presenters wish to provide. So if you have any questions at that point, do feel free to reach out directly to them or to myself. Thank you to the presenters, Deirdre, Betty, Eileen, much appreciated for participating in the health sector session.
Thank you.
Thank you for the opportunity.
No worries. And to everybody on the call, have a great rest of the day.
Okay, take care everyone. Bye-bye.
Bye everyone.